All right. Welcome everyone to today's webinar. Today's session is looking at interoperability in digital health ecosystems, specifically looking at the Tamanu mSupply integration. So Tamanu is an open source electronic medical record, and it's currently being used or implemented in 8 Pacific Island countries. And mSupply, of course, is the most widely used logistics management information system for health supply chains in low to middle income countries around the world. And it's actually used in almost all of the Pacific Island countries. So, as countries across the Pacific continue to grow their digital health systems, ensuring that health information can move seamlessly between those systems is becoming increasingly important. Interoperability is not just a technical consideration, it really does help to reduce duplicate work for health workers, helps to improve data quality, and supports better patient care and health system management. So, today we'll hear from 4 presenters about how the integration works from both the user side and the technical side, why it was developed, and some key lessons from implementation in the Federated States of Micronesia. We'd also like to thank DFAT, of course, for supporting the Pacific Digital Health Webinar Series through the Partnerships for a Healthy Region initiative. As we go through the presentations, please pop any questions that you have into the chat. The presenters can respond there. And if there's any other questions at the end, we will also come back to those. So our presenters today, we have 4 of them. First, taking us through the live demonstration of the Tamanu mSupply integration, Karina Minko and Chris Petty. So Karina is a project manager with Beyond Essential Systems for the last 3 years, and she's worked on Tamanu and Tupaya projects across Nauru, Fiji, Samoa, and Tonga. And Chris Petty, who's a senior software developer at the mSupply Foundation, who contributes across all products from mSupply Mobile to integration plugins in Open mSupply. We then have some presentations. We have Diopoulos, who is the DMI coordinator for the Federated States of Micronesia Health Department, who will share country experiences on the very recent rollout of this integration. And then finally, we'll hear from BES's Rohan Port, who is a software engineer and solutions architect who works on both Tamanu and Tupaya, and his work is currently focused on integrations. So Rohan will take us through the technical side of the integration. So to get started, I'm going to hand over to Karina and Chris, who will start us off with the demo.
Great, thanks, Em. I am just going to share my screen and open up Tamanu where we'll start. Okay. So I'm going to show you, just to begin with, a couple of different ways that we can dispense medications in Tamanu and then send those over to the pharmacy where the mSupply team can take over. So currently I am just looking at one of my patients, and I'm going to go into her medications tab, and I can see that she is on some ongoing medications. So for example, Pebbles might have come in just for a repeat script of her diabetes medication. And so on our ongoing medication table, I can already see here all the medication she's on. And I just want her to have a repeat of her diabetes medication. So this button over here, the Send to Pharmacy button, when I click on that, it lets me select which medications that I want to send over to pharmacy to dispense. And in this instance, I'm just going to dispense her another round of her medications. So a little note in there. And when I click that, I should get a little message saying my order's been sent over to the pharmacy, and I can send Pebbles over on her way to the pharmacy to pick up her medication. So super simple and straightforward from the Tamanu side. But the other thing that is happening in mSupply, or with the mSupply integration, is that the Tamanu is now acting as the patient master index list. So all the patients that we have here in Tamanu, are also going to be appearing over in mSupply. So any new patients I create, any update to patient details, so names, date of birth, that I change in Tamanu, will go over to mSupply as well. And so I suppose just to demonstrate that, what I'm really quickly going to just go through and do is create a whole brand new patient. So not someone that has been sitting here in Tamanu for me to play with. Just very quickly. I am going to open a new encounter. So I'm just seeing Chloe today. She's come into the clinic. Outpatients. And I also want to dispense some medication for her. So I'm now within an encounter. So rather than looking at her ongoing medications, I'm dispensing something actively for today's encounter. So under our medication tab, I can click on our new prescription and I can set up what I would like to send Chloe home with. So I'm going to send some omeprazole capsules for her. Capsule daily. Say with food. So just filling out her prescription. I have said 1 capsule daily for 2 weeks. So 14 tablets and no repeats for her today. So I've made my prescription and the exact same as what I did beforehand. I'm going to click my Send to Pharmacy button. And click Send and send that over to mSupply. So what I'll do now is hand over to Chris to show you what should be happening on the other side.
Cool, thank you. Hello, everyone. I'll sending a request to hijack the screen sharing. There we go. And just sharing the right screen. Hopefully that looks good. So we're in mSupply now in the dispensary store for the setup. And basically, as a pharmacist, I can come into our prescriptions list and see here the prescriptions that have come through from Tamanu. We've got some codes here that indicate the link between the two systems. And here's one for Pebbles earlier. So now we can dispense medicines. Apparently, that's just a placeholder, but we can select a different item, a different batch, and go with that. It should work. Nonetheless, maybe better luck with that one. Yeah, that one got it going. And from here, we'd be able to print labels to stick on to bags or boxes or vials, and then mark it as done. No printer on this online setup. Yeah, so that comes through pretty promptly, and you're able to issue the stock and get the patient sorted. Shall we do the FSM one next?
Yeah, I'll share my screen again and I can just show what that looks like in Tamanu. Sorry, I'm just going to keep my camera off because classic timing, my internet has decided it's going to slow down right as we do the demo. So what we were showing you there was our sort of Tamanu to mSupply integration where we're sending prescriptions over to mSupply and hopefully it's really nice and clear. We can with this integration, we're going to be able to move away from having to write paper prescriptions, which is really exciting. The other thing, we have another integration with Open mSupply, and that can be used for if we're doing our dispensing through Tamanu, but still to have the stock management component. So over here on our dashboard, we've got, on our main menu, we've got the medication menu items, and under our active requests, you can see here a table. So these are the couple that I have just sent through to pharmacy. Now, obviously, if you're using the integration, which we just demoed, you wouldn't need to be coming in here to dispense. But for example, in some of our deployments like FSM, they'll be doing their dispensing through Tamanu. And so they'll be coming to look at this table and seeing their medication requests here. But what we can see over on the right-hand side here is we've got a little stock column, and this is getting information back from mSupply, telling us if that medication is in stock. Now, this is demo, so we haven't set it up for every single medication, so you forget us some of the unknowns there. But for example, this prescription here, so for Elizabeth Bennett, her clarithromycin tablets, if I am dispensing from Tamanu, I can just click on that. It'll show me the details of that, so how many tablets and the instructions. And if I click on review, it'll also allow me to print that label directly from Tamanu. So if I dispense and print, so 21 tablets, I won't actually print. You can see that's dropping off my active requests, and it will appear on my dispensed medication table here. But probably back over to you, Chris, because what's still going to be happening is that information is still getting sent to mSupply for the purposes of stock control rather than dispensing.
Thank you. So back in mSupply land. So this one being slightly different, it's an open mSupply, and just to clarify, you would not use the previous integration that we just demoed and this integration at the same time. Wouldn't really make sense. This is more of a incremental improvement in the sense that all the dispensing is happening in Tamanu and the stock management is just happening in open mSupply. So Tamanu would basically, when it fires off the data, it will create an outbound shipment automatically, and it's just stock getting sent out. And as a general patient, it just is for all of that dispensed information. And what's done here is generate an outbound shipment just of that stock. It will automatically choose stock based on what's available. The only stock that was available is expired, so that's what I've got, and it's been automatically shipped. So that's going to automatically reduce the stock levels in open mSupply. If there wasn't stock available, it would create placeholders for the stock managers to go through and figure out what to do to make sure that the data is accurate to what's happening in their medicine store. That's all to show for this, really.
Thanks, Chris. And one thing, sorry, I forgot to mention, when as a clinician, you're actually dispensing the medication in Tamanu, that information also comes back in when you're actually doing the dispensing. So I can see here, I've gone to select those clarithromycin tablets, and Tamanu is telling me that information that we've got that medication in stock. So a lot of back and forth between the two. Again, this is demo, so probably more medication than we would have on hand. But yeah, so just sort of sharing that really important information back and forth between there. So just so I'd share that as well, just quickly. But I think that's it from the demo side. So maybe back to you, in.
Great. Thanks, Chris and Karina, for the intro and seeing what that looks like for the users. So we are now going to hear from a real-world implementation of this integration. So we're lucky to have Diopoulos with us here today. Diopoulos is the DMI coordinator for the Federated States of Micronesia Health Department, and he'll be sharing their experiences on the recent rollout of the Tamanu mSupply integration. So I will share my screen, Diopoulos, and you can just let me know when you're ready for me to move the slides across. Give me 1 second. Okay, so over to you, Diopoulos. Thank you.
All right, so good morning, everyone. Like what Emily, is it okay to call you Emily? All right. So I'm Diopoulos. I'm the TMI coordinator for FSM Health here. There are a lot of things that are going on here on the ground, especially with a lot of systems that are rolling out at the same time. So today we're gonna be I'm gonna be sharing some of the things that we are experiencing on our site. So can we go to the next slide again? All right, so the department itself has its own health development framework. It's a 10-year strategic plan that consists of a lot of things. So one of the pillars in there, can we go to next slide? Oh, again, sorry. So we got 7 pillars under the plan, but for our part is we focused on pillar number 4, and it's on HIS and surveillance, making it better for the how we collect the data and how we transition from paper-based management to electronic systems. So this is basically it. For pillar number 4, we have also developed our own digital strategic plan that is more specific driven for this one. But I'm not going to be sharing that. Maybe this is okay. So can we move to the next one? Okay. So why matters to make tracking progress toward our main goal is universal health coverage. And then we also need to add this. Before I'll go over these reasons, is that because if you know our nation geographical location, it's really far apart. Okay, so our 4 states is one state miles away from each other, and our country is the only country, if you're going to travel by plane, that you have to reach into another country to get back to another country. So that's probably the most challenging thing about implementing this project. So yeah, so these are the reasons for uh, us moving forward for this one. Any questions? No questions? Okay, can we move? Next slide, please. So these are the target categories to strengthen capacity building of health information planning and surveillance, data management unit, develop, implement robust health management information system. So this is the reason why we move into Tamanu, because we actually have our own. It's a locally made EHR. But in order to improve on this existing EHR, we wanted to have more robust and driven data management, health information system. Next one. So the implementation itself started back in June 2025. So there are a lot of ground assessments made. I would say that the most challenging thing is traveling to the 4 states to get assessments for the infrastructure capacity, looking at operation and workflow, future management, and how we gonna do the integrations. Because for now, we uh, we started out the implementation project by piloting out one of the states, so it's Bombay State, back somewhere late 2025. So it took us a while to actually get everything together, but then we decided to use Tento as a pilot before we even roll out to the main hospital at Bombay State. Because Tento is like a small clinic. It has everything starting from triage to doctors and encounters. They do their own labs. They do their own medication. X-rays, and they also do their own finances. So that's the thing with us, because we also involve invoicing in uh, the implementation. So when it comes to the integration, it has to go back to mSupply, looking at X-ray, looking at the lab, and others. So we divided the phases into phase 1 and 2, and it's really depend on the state. So in Bombay State, phase 1, we rolled out Tendo, outpatient, records, invoicing, pharmacy, imaging, and lab. First phase. We took like almost a week just to monitor, help with the users and the workflow. And then phase 2, we deployed the at inpatient physical therapy and dialysis, including LND. I missed that. Any questions for me? No. All right. Next slide. So this is basically the workflow. I know it's kind of messy, but on your where is it? On your right, that's the HC Lab Tamanu integration workflow. You notice that I highlighted number 2 and 3 is we're gonna disregard these two uh, routes and then just stick with number 1, 4, and 5, and this is what we're aiming at. Actually, today is they're testing it as we speak. They're testing out this workflow and see if it works. So I'm hopeful that it will work, so we can actually start rolling out to the other states. On your right, that's the workflow for uh, Tamanu and mSupply, where prescriptions are made and then validated by the stock at mSupply. And then approval is made by the cashiers, and then they can dispense the medication from pharmacy using the Tamanu. Great. Are you guys following through, or am I going too fast?
No, this is good. Yep, we're following. Thank you.
All right. So yeah, this is basically it. These are the workflows. All right. So next slide. All right. So let's look at mSupply. So real-time stock visibility. So mSupply stock data display. So what they just basically showed us earlier. So physicians see current medication before they prescribe, and then it reduces stock outs and improve prescribing decision. This is bidirectional sync, so it syncs every 2 hours. Okay, it syncs every 2 hours. Uh, Benefits, that's what we're aiming at, because we're only into like almost 50% of the project, where Bombay is like fully implemented with all the integrations, except for HC Lab, where they're testing out today. So these are the benefits that we're looking at. Next slide. So HC Lab, it's a bidirectional communication via middleware. So we have a middleware that does do the communication. So we're all hoping today that we're gonna get good results. So these are the things that we're looking at, how they're gonna do the testing today. So we have our key benefits. So it's for performance efficiency, get the physician get real-time notification and publish the results, reduce manual entry and errors, and it makes things faster, especially for decision making. Next slide, please. All right. So challenges, especially for HC Lab, because it's been a while. If I'm not mistaken, it takes us about 7 to 8 months to do this. So these are the challenges that I think we have with the integration with Tamanu and HC Lab. And one of the things that I really wanted to point out is that maybe from PES standpoint, they might provide an API documentation whenever they're doing integration with other vendors. So it's makes things easier, because it seems like it's been like when communication are done between these two parties, especially with PES, they're putting out chunks instead of the whole thing. And I think it's both parties. So uh, the most I think it would be better if they have an API documentation that can uh, that they can work with, instead of going back and forth. So yeah, like what I said, it's like 6 to 7 months for us to get this thing. And actually, today is our final day to test it out. Good. All right. Next one. So these are the highlights. We're in YAP right now. Uh, we're in the deployment phase, so it's already been launched. We're monitoring the system. Sorry, we're monitoring the system as we're moving forward. We do phase 1 and phase 2 at one time, because YAP is smaller than Pompeii, so it really depends on the state. So our next deployment is in Kushrai. So we're adding there and Chuk. That's it. I think that this is the end. Any questions for me?
Perfect.
And I'll love to do this again after we get to 100% completion of the project, because it's kind of really hard for me, because this is only we already done in Pompeii, a little bit in YAP, and if we have an overall complete implementation of this project, I'll probably have more in-depth highlights and challenges that I can share later.
No, that's great. Thank you, Diopolis. It's good to hear from you while things are actively happening on the ground. And
But
thank
yes, everything is especially for mSupply and Tamanu, I would say it's fine. It's gonna be, yeah. Because we already tested out in Pompey. It's just that we need more time to do a lot of trainings with these users. Uh, but yes, we have communications with Savia and others that are helping us out with the navigation of the system, doing training if needed. So yeah,
No, that's fantastic. And like you say, it's an ongoing process, right? Like it's not like you just turn these things on and then that's the end of it. It's a
yeah,
process. So we'd love to hear from you in a few months' time once once things have been in action for a longer period as well. So
yeah.
thank you, Diopolis. And if anyone has questions or you think of things as they're going, please again just pop them into the chat and we can also come back to them later. Thanks so much, Diopolis. Okay.
You're welcome.
So we will move on to our final presentation. We have Rohan Port from BES, who's going to take us through the more technical side of the integration. Again, Rohan's a software engineer and solutions architect at BES. So we will hand over to Rohan to take us through the technical side of the integration.
Thanks, Em. Hi, everyone. Yeah, I'm just here to talk through sort of particularly just the Tamanu mSupply integrations, what's going on in the back end. Yeah, can we jump to the next slide? Cool. Okay. So I don't know where that line came from, but yeah, so just to recap, there's sort of from a technical side, there's sort of three integrations in play here. So the first one is that PMI integration that Corinna was talking about, where you can create a patient in Tamanu, and then that patient will automatically sync over to mSupply. And that's great because it just allows there to be a single place where patients are managed, as opposed to trying to manage them independently in two systems and trying to keep the codes all matched up. Yeah, so that's the PMI integration, and that's been live in a number of countries for a couple of years now. And it's Fire-based, which I'll get a bit more into Fire later on, but that's a pretty core part of the integrations we're building. So the next one is that prescriptions integration, and that was that integration where you can create a prescription in Tamanu, order it, and then if you go over to mSupply, that will actually show up in legacy mSupply, and you can dispense it from mSupply. So that hasn't launched as yet. That's launching in Nauru pretty soon, and that one's also Fire-based. And then lastly was the stock management integration that Dio was just talking about in FSM, which is a new integration we built for FSM. Now that one isn't Fire-based. It instead uses the GraphQL API that OpenMSupply provides, and that's a very flexible and powerful kind of API. So it made building that integration really smooth. Cool. Yeah, let's jump to the next slide. All right, so we've got some diagrams here, and I hope it's not too intimidating. So what we're looking at here is the sort of PMI and prescriptions integration that works with legacy mSupply. So you can see in the top right there, that's the Tamanu central server. So both applications, both Tamanu and mSupply, are designed to work offline. So your facility can be running offline without connection to central. Likewise, your mSupply store can be running offline, and then they periodically synchronize data with the central repositories. But the integration just talks from central to central. So we essentially send data from the Tamanu central server over to the mSupply central server. And we send both patient information for the PMI integration, and then we also send those prescriptions. And that's all done via Fire messaging. And then each system just relies on their own synchronization mechanisms to get the data down to the facility, to the store in the eyes of users. There is one, I guess, drawback with this kind of system, which is that it requires, for all these errors, it kind of requires the internet connection to be working there. And actually something that we're working on and hoping to release in the coming months for Tamanu will be the ability to do Fire messaging directly from the facility, so it wouldn't require that sync with Central. And at that point, I think mSupply might also be able to have their facility or their store talk directly to the Tamanu facility. So everything could work just in the local area network, even if the network's down. Cool, yeah, can we jump to the next slide? So what is FHIR? Because I have been talking about it a bit. So it stands for Fast Healthcare Interoperability Resources, and it's the latest standard of the sort of HL7 standards, which have been standards that have been adopted throughout the sort of medical software industry for many years now. It's what's called a modern RESTful API. So it relies on a very well-established method for communicating via the internet. Most web applications that you use today are using RESTful APIs. And it's great because it just fits so seamlessly into the kind of tech stacks that most software development is happening on these days. It's also secure by default. In the same way that all your internet traffic is secure by default, FHIR is secure by default. So you don't have to worry about setting up any kind of VPN or anything to keep your data secure. You know that the messages themselves could never get hacked. And yeah, the standard has been adopted worldwide. So there's a lot of adoption in the US, but throughout the world, it's becoming the sort of de facto standard to use for healthcare software integrations. So we rely on the patients and the medication requests resources here. And if it might be fine if the screen share doesn't work, but if we just want to jump into that FHIR patients link. Oh, great, cool. And if you wanted to just scroll down a little bit. Yeah, here's good. Now, I know this is a lot of technical mumbo jumbo, but I think I just want to touch on that point that Dio was raising about API documentation, because that is a really complicated thing with integrations. And so the good thing about both Tamanu and mSupply using this kind of FHIR standard is that essentially the API documentation has already been established for you. So neither of us came up with this standard. This was set up by a really experienced body. And then we just do our work to kind of comply with this pre-existing standard. And every detail that you could imagine has been pretty well thought out here. So it's a really good standard to be working off. Cool, yeah, thanks for that. Okay, cool. Yeah, so what we're looking at here is this much simpler diagram for the stock management integration. And that's because this one is that what I was talking about before, that sort of facility to store direct connection. So you don't have to worry about an internet connection to either central server. And as you can see here, there's this nice little loop going on. And as Dio was saying, this loop will run every 2 hours in the FSM deployment. But for demo just then, we had it running every minute, where Tamanu essentially pulls the stock information from mSupply, so it knows what the stock of every drug is. And then whenever we make dispensers, we keep a list of those dispensers, and then we just send them over as a bundle over to Open mSupply. And so this does mean that essentially, you have this great record of the stock management, and it could just be Tamanu that's making dispensers here. But if there were prescriptions being dispensed from Open mSupply from other places, those would all still sit within the single stock management system. So you're not going to run into a problem of the two systems falling out of sync about whether or not drugs are in stock. Cool, yeah, let's jump to the next slide. So here, I just wanted to sort of mention that there are lots of other integrations in the picture, and I kind of wish I didn't realize that you'd be talking so much about the HC Lab integration. I should have mentioned it in here as well. But with the little computers with the arrows, you can see that both Tamanu and mSupply push aggregate data to DHIS2. So if people are using DHIS2 for sort of a bit of like an analytics reporting engine, both softwares support pushing data to that. I believe mSupply also supports pulling data from the LMIS DHIS2 module. And then, over there on the left, you can see we've got here Senite, which is a LIMS software similar to the HC Lab software that Dio was talking about, as well as Voyager, which is a RISPAX imaging software. And there's also another one called MerlinView that Tamanu integrates with. And all those integrations are sort of FHIR-based integrations. So I put that FHIR symbol in there to indicate that, yeah, by using this one standard, we actually have pretty much the exact same integration. There's nothing really custom between those Voyager and CDN MerlinView integrations. And likewise, that Senite integration is almost exactly what we have for the HC Lab integration. So by complying with a common standard, we can basically save work of rebuilding a whole new integration for each new software we connect with. Yeah, I think that might be it for me. Any questions? Just let me know.
Great, thank you, Rohan. So we have heard about, yeah, the front end of this integration, the back end, an implementation experience as well. We have a couple of questions in the chat, which I think have both been answered now. If there's any other questions, please feel free to raise your hand. Nope, doesn't look like there is at this stage. Oh, we've got one more that's just come through the chat. So from Papua New Guinea, that we're currently implementing mSupply store module and dispensary module as a pilot for one of our sites in Western Province. Is ICD-10 used as well? Maybe, oh yes, okay, thanks. Michael's responded to that one, yes. So yeah, ICD-10 is used for coding by default. Okay, if there's no other questions, we will end the webinar. So thank you so much for joining us. Our next session, we're actually going to be talking about BES's move to a not-for-profit. We are becoming BES International, which is very exciting. So in our next session, we'll talk about what that looks like and what it means in practice. So thanks everyone for joining us. We'll have a video recording of this webinar up on YouTube shortly as well, so feel free to share with any colleagues who may be interested. Thanks, and we'll see you next time.